Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose. Welcome to the Truth Behind Dentistry podcast. And today I am super excited to be joined by Amber Correra. Amber served as the Dental Hygiene Association student president, and this leadership role fueled her commitment to make a real impact on oral health and to become an entrepreneur. She fulfilled her dream of owning an independent dental hygiene office, highlighting quality care while managing work-life balance. This journey led her to develop an innovative dental hygiene business model, which emphasizes access to care while providing dental hygienist autonomy. This venture is rooted in the belief that fostering independence leads to a more fulfilling and impactful professional career, a testament to the potential for positive change within the dental community. The goal is to contribute to a broader shift in the profession, empowering and enhancing the overall quality of oral health care delivery. Welcome to the podcast, Amber.
Thank you for having me. Thank you for this opportunity. I'm very excited to share how I got to where I'm at and the things I've learned along the way, with the hope of influencing other people who would like to go into independent hygiene practice.
Well, that's awesome. I've been looking forward to this, so I'm glad you're here, and we're going to kind of dive into that for a little bit. You had shared with me that your dental story started when you were quite young, so maybe you can tell us just a little bit about how that did begin.
Yeah, I think I was the age of 5 when I recognized that I wanted to work with teeth. My mother was a very young mother. She got married at 19, had me shy of her 21st birthday. My parents actually did not graduate high school. They went back and got their high school diplomas together at 25, and my mom, right thereafter, started going to community college to become a dental assistant. And money was tight, so she would take me to school with her, and I would sit beside her in lecture, and they would give me, coloring pages of teeth. And but I think it was really that moment where I had the aha, like, oh, when I get older, I want to work with teeth. I remember standing in the dark room and watching them all hang their X-rays, and that's kind of where it all began, my interest with teeth and oral health.
That's a young start. I'm not sure what percentage of the people involved in dentistry were enamored by teeth at that age, but I think that's great. That's great to have that draw at that point. So, how did your college experience then? We kind of talked a little bit about the leadership role that you had. How did that influence your decision to pursue more of an entrepreneurial approach?
Well, I think it even goes back prior, before that. 5, I realize I want to work with teeth. 8, I get on braces. 12, my first school group crush was on my orthodontist. All these people, my dental hygienist that I had in my general dental office, she really inspired me. They took the time to explain to me what they were doing and engage me because they saw that I had an interest in dentistry. And so when I had the opportunity to graduate high school early, I followed my mom's footsteps and I pursued dental assisting. I figured it would be a way to earn some money to help me put me through college. And so I became a dental assistant, and I excelled in that. And I got a taste of what it was to be given opportunities when you work really hard. So I graduated valedictorian of my tech school, and I got the opportunity to give my first speech. And that was a moment where I recognized, oh, I have the ability to take risk and put myself out there for things that matter and are important to me. And so when I got to hygiene school, that continued. And that experience in the college setting was they were exposing me to other people who were doing the same thing that I wanted to do. And I think that's a key to success, finding mentorship, finding people who align with your belief and your purpose, who want to accomplish the same things, and then seeking out those who've already done it. And college really inspired me because of these relationships I got to build. Having the platform as a student president, you're exposed to what it takes to get laws passed, to look at the major issues of your profession and what's working and not working. And one of the pivotal moments I remember is they had a woman come and speak to us about independent practice.
Mm.
And what resonated with me is she took the risk of leaving the United States to go learn and innovate and apply independent practice in Canada. And she came back and was speaking to us. That's really that second aha moment. Like, okay, if I'm really going to take on this role and I'm going to make this my career, what can I do and provide to continuously grow to make it better? And that's where entrepreneurship came for me. I recognize to have access to care is you have to take those risks and you have to think outside the box and come up with solutions to improve whatever models are in place.
That's good. I was thinking as you were saying that, as far as the out of the box kind of reference, and or even as were speaking earlier about kind of disrupting um, the status quo, right? That sometimes there's ways that things are done, ways things have historically been done, and we can get stuck within those parameters and not be able to see outside of them. But I think it sounds like you had experiences early, and that was one key person anyway that inspired you when you were in college then to to frame it in a different way as to what was possible then within the profession, right? And are there other people too? Were there other experiences when you were in college that kind of expanded your boundaries in that area?
Yeah, I mean, at that time when I served as a president for Florida, it was a very exciting time within politics in their state because they were getting ready to pass legislation that would allow dental hygienists to look in patients' mouth outside of a dental practice. Up until that point, you couldn't even do assessment at
Mm,
health fairs.
mm,
And you talk about the population for the state of Florida. I mean, a lot of people go there to retire, right? And who's caring for them in these nursing homes or the retirement homes. And I think that they saw the value in that. So it was a really exciting time for me to be involved. Um, I got to go and speak to, the representatives and sit on the Senate floor. But while I was there at the state capitol, I saw Maria Bush on
mm,
the lawn. And I
mm.
thought, I'm going to go up and I'm going to talk to her. And I'm going to tell her that we have a law that Jeb, could possibly sign into law that would change, healthcare for the citizens of Florida. And that was huge. So I had a friend with me and I said, I'm going to do it. And she goes, no, you're not. I said, yeah, we are. We're going to go. So I walk up to myself, up to her and I introduce her and I explained to her what this would mean for the state of Florida and oral health care. And she was so gracious that she shared a personal story with me about how she valued this as well and why she think that, she thought that also people living in Florida and certain populations could benefit for access to care. And that was huge because that was the first time that I recognized like, okay, if my industry is sort of pushing back, but the rest of society is not, then
Mhm.
there's importance in this purpose. And this is why people are taking the risk and trying to come up with new modalities to make it better. And that left really a lasting impression on me that I knew after hygiene school that I was going to try to continue that movement of access to care because I believe that dental hygienists are very underutilized, especially now with science. We know how the mouth is connected to other parts of our body.
Mhm.
Why aren't we with other facets of medical? And that's the exciting part of independent practice is because it allows you to be innovative. It allows you to think about like, where else could I be giving the message of oral health care and the systemic link?
So your boldness that day in going up to her was rewarded, was well received. And so that probably just empowered you more, right? To go, hey, I put myself out there, I was heard, and the message was valued. So good for you. Good for you to be willing to do that, so that was a catalyst, it seems like, for you to keep moving forward.
It was a catalyst, but there were a lot of other people for many, many years that worked hard for that. So I don't believe that interaction was the reason why Jeb Bush signed it into law. But, I think not being afraid to share your truth and your
Mhm.
passion allows other people to see and it resonates with them. And that's how change really can happen. You
Yeah,
can't sit quiet.
And it was a catalyst for you, no matter how much
Yeah.
your voice catalyzed Jeb's actions, at least it was a catalyst for to keep you moving forward, it sounds like. So,
Yeah, because it just really resonated how important it is and how important it would be, and it is for dental hygienists to be allowed to, leave the confinements of the dental office and educate in other facets of the medical, you know.
so let's talk about that. And I do agree with you, as you were mentioning there, as far as kind of the disconnect, the siloed elements within healthcare in general, but also in the dental world, often disconnected from other healthcare expertise and contribution. So I love seeing more integration of insight and knowledge and collaboration, because I think it's in the patient's best interest. But going to amplify on the independent practice element, I'd love for you to both uh, share some more input as to why you think it's that important to have an independent practice approach. And then maybe from that into give us some elements of what that looks like. How does that play out in a practical way?
Well, I think that, not everyone has health insurance, and not everyone is able to get to the dentist, and a lot of people don't go until they're in pain. So they're not really getting the message of preventative care. And
Mhm.
I think a lot of the medical community is relying on the dentist to provide that. And I think the dentists are relying on their hygienists to do that.
Mm.
So I think it benefits us, allowing us to be in other facets of healthcare so we can really educate people on the fact that your mouth health is, connected to the rest of your body through
Mm.
the bloodstream, through that saliva, and it is affecting all your other organs. And that's a very important message to give people. And because, with independent practice, you can kind of do that. I mean, right now I'm meeting some amazing people in my profession who are aligning themselves with other facets of medical, like working alongside cardiologists and developing saliva tests, learning about diabetes in their patients, and aligning themselves with technology to bring it in the office and start screening people. I mean, these are ways that we can connect that gap. And I think that the industry is recognizing the value of dental hygienists as well. And I think that a lot of hygienists in the last couple of years are really taking these leaps and risk by stepping outside of clinical hygiene and aligning themselves with companies and tools and other facets of medical to educate that, hey, we're here, we understand the systemic link, utilize us and help us get that message out of how important oral health is. And I think the fear that dentists have always had is like they don't want us to leave clinical hygiene,
Mm.
but there is some true value for them as well, because we need them just as much as they need us. Whether you're an independent practice, you're not going to leave your patient hanging. Like,
Right.
we can't fix teeth, right?
Right.
So you're gonna collaborate. When I was an independent hygienist, I wasn't just, with one doctor. Now I'm the hygienist to all the doctors.
Hmm.
And that's really beneficial to people, because then as I spend more time with them, I find out what's important and what they're trying to accomplish with their oral health. I'm able to recommend them to multiple people for them to find that perfect fit, for them to get that exceptional care.
So this is definitely better for hygienists in the sense that they're not necessarily bound solely, say, to one doctor or one practice for that relationship, that they could have many relationships and find those ones where they are,
Fine.
able to, yeah, to be aligned to create more mutually beneficial results, and better for the patients in the sense, well, I mean, it seems like one thing you're saying is that it's inviting hygienists to take more of a leading role, maybe than they have been invited to in terms of that oral systemic health connection and that sort of thing. I mean, they could do it within the practice currently, or maybe not so much in certain offices because that's not that
Well,
office isn't inviting
let's
that.
talk about that. I think that's really what's happening right now within my industry with talking to my colleagues and being on these blogs and listening. And the one thing that's really coming back at me is burnout. I think a lot of hygienists feel, underappreciated, undervalued, underheard. They feel maybe constrained. I think it's really hard to find that office. It's been called the unicorn office, right? Finding the office that aligns with your values
Mhm.
and also supports you enough in your growth. And I think that a lot of work is being done one-on-one between the hygienist and the patient, and you're getting that validation from your patient, what you're doing. But, with the rustle and bustle of the day-to-day of dentistry, maybe no one in your office and your team is really recognizing that. And
Right.
I think that a lot of hygienists feel maybe stuck. Maybe they're not able to get the equipment they want. Maybe they have no control over their schedule. Maybe they don't get to say on who they're referring to. A lot of times for me, I've always been passionate about perio, and that's where I put my focus and my skill set. And I wouldn't really get a say on who I'm referring my patients to. And I would, send my patients away, but the periodontist wasn't talking to me.
Mm,
I wasn't getting the letter.
right,
So there
right.
wasn't that collaboration happening. So when I went out on my own, that was something that I really focused on was how do I get to collaborate with people that align with my values when it comes to me giving periodontal therapy?
Mhm.
And that freedom in that makes you grow and feel validated in what you're doing and makes you a better clinician. I think the takeaway for me, and I think for dentists right now, it's like it's time to start elevating your perio practice and elevating your hygienist to be heard and valued within your team. And I think a lot of hygienists, when they were forced to, during the pandemic, they thought, okay, I'm going to go out and see what other parts of my industry are going to value and see me. And I think a lot of them have taken on other opportunities because of that or the lack thereof.
Yeah. Which has been part of creating a seeming shortage of available hygienists for many practices. And I'm in coaching relationships with quite a number of them who are feel like they're always needing something more from a hygienist standpoint. And I'm curious as to kind of model options. So would you say from your perspective, the ideal highest good would be to have all hygienists or a majority of them be independent practitioners who almost as their own specialty and then had relationships with GPs and any other specialists? Or do you still see a place moving forward for a sizable percentage remaining in the offices if they have a great office, maybe if they feel like this is a home for me, I love what we're doing here and this works. So how do you see the model options moving forward?
Right now, I think a lot of people are deterred because of that word risk, right? Being an entrepreneur means you're taking some form of risk. And I think that that hinders the hygienists within states that do have independent practice. It took the cost to get up and going and to get started.
Hmm.
Putting yourself out there and now it's all up to you to make that money, right? It's up to your marketing skills, your collaborating skills, and that can be very scary for people. And so I think that even in the states where there isn't a practice, you haven't seen a huge jump of hygienists doing that. And so I started really thinking about that. I'm like, okay, well, why did I do that? And how do I help other people who are not like me, right? In that sense where I'm willing to take a risk for that reward.
Right.
Um, I think there's a lot of hygienists that are happy having someone else be in charge of the business. They want to just go in, see their patients, and go home and not have to do all the administrative. So when I started making this model, I started thinking about those things. I started thinking about like, well, why do people leave a traditional private office and they go and work for a corporate office? And I started
Mhm.
looking at like, what did they implement to get hygienists to come to them? And then I started thinking like, what did it feel like to work for corporate? And I have worked for corporate as well. I've
Mhm.
worked for two. And I took all those experiences and I have come up with a business model that kind of takes the best of all of those things from the hygiene standpoint, point of view. And it's really, it will empower dental hygienists to take that fear away. One, they won't have to come up with the whole cost to get started, but they'll have that community and that community support and collaboration. Um, and so I think that's really what hinders people from doing it, and why they don't do it initially, is the fear of letting go and having to rely on yourself. You
Yeah,
know, if you're not the one providing the service and you're not the one out there promoting yourself, you're not going to be successful.
right. Which just kind of fits with how many dentists as well are not necessarily driven to be entrepreneurs. I mean, I work with a lot of genius, smart, technically skilled people who not only didn't necessarily get much business background, but now would also be in a place of needing to be a leader of people. And where did they learn how to be leaders, right? So there's a lot of gaps in the whole educational process preparing people. So I think many feel much more comfortable not having to have entrepreneurial risk even as doctors, right? So that makes perfect sense to me. So I think part of what you're saying is, what is that best fit for you? Or maybe in terms of what you're offering, you're helping bridge gaps, standing in the gap then to provide, maybe to provide resources and guidance to people who would want to move into more of an entrepreneurial direction but feel ill-equipped, or that the risk seems too high. Would help mitigate some of that.
Yes, I recently had the privilege of meeting a woman who is already executing a model very similar to mine in the state of Colorado, and that's exactly what she has done. She has given the group of hygienists the exact same thing they had in a dental office, minus the dental restorative part of the model.
Mm-hmm.
And I think that if there was that model in place, I think that it would allow for a lot of other hygienists to want to go into independent practice. And I think that, you know, there are a lot of dentists right now that would not love to not have to get up and go and give an exam. You know, they want to just focus on their dentistry.
Mm-hmm.
Um, and there's a lot of dentists that don't want to have to work with 16 to 20 people in their space. So I think that having a model like that could benefit a lot of those other areas where people are struggling within the current model of the traditional dental model.
I like that. I like that. That's the out of the box thinking, right? It's how can we reinvent that can be a win for everybody, right? There's no, who says that it has to keep looking like it has ad infinitum into the future, right? This is very interesting to me, and I'm excited by what you're doing. Before we wrap up, is there anything else you want to share, uh, if in speaking to dentists watching this, uh, as well as to hygienists watching this, that we haven't covered yet? To either of those viewers, what else might you want to say?
Well, I like to say that I would love for people to reach out to me if they're interested in independent practice and want to learn more. And I would love to be available to collaborate and to continue building this idea that I have. But I would also say, you know, no matter what you're doing, I think the most important thing is asking yourself why. You know, why am I doing it? And is it fulfilling me? And getting real with yourself and speaking your truth. And, you know, dentistry is, it's a unique profession because you spend a lot of time with those people that are around you. And we talk about team a lot, but really it's like, what is everyone's values and do they align, and what is our goal that we're trying to accomplish in the day? And I said this to you, I think people just want to be heard and they want to be valued, you know, and I think it's really simple. No matter what you're doing, just looking around the people around you and letting them know that you appreciate them and that you value them, and showing it through actions, through words, figuring out how they're going to receive it to hear it.
That's good. And I also was thinking too about that. I know that pay has gone up since COVID to a reasonable degree, maybe more in some locations than others, for to what hygienists are receiving. But I'm thinking too, especially as we're talking, that some more pay is not necessarily sufficient for people to feel seen, heard, rewarded based on what their inspirational drivers are, right? It's not
Right.
necessarily just a bit more cash. I mean, I never run into anybody who says less money would be a good thing, but it's not just that, right?
It's not. I mean, I just left clinical practice the end of December, and I was being compensated very well. It's not about the money for certain people, and I think you have to find out what that motivator is, and align yourself with the people that resonate with that. For me, it's having control over giving the best care to my patient and having those systems in place that allow me to do that. So not being provided the technology that I think science is aligned with to do that, not allowing me to have a say on who I can refer my patients to, not giving me the opportunity to have a vacation because you don't have a temp service in place to allow me to do that, or you don't want to move my schedule. Those were the reasons why I decided, I need more autonomy to be the best version of myself. So I think, you know, asking your hygienist, what is working for you? What's not working for you? How can I accommodate you? What do you think we could do to improve our office? Allowing them to have a seat at the table,
Mm-hmm.
and letting them be an active part of growing your business and your patient base. I think there's a lot of hygienists who would love to have a seat at that table. I mean, we're giving ourselves and our body physically and mentally and emotionally every day to the people in our chair, and we want to be seen and valued for that. It's not about the money.
Yeah.
For
Yeah.
some it is, and they'll get burnt out.
Right.
Because truly what kept me doing it for so long was the relationships that I got to make with the people in my chair.
Mm-hmm.
And this is probably one of the most rewarding professions you can have, because you really get to connect with people on a level that they don't necessarily show everybody. Being in a dental chair back with your mouth open is a very vulnerable state.
Mm-hmm.
And you're putting a lot of trust into that person. And I felt very honored every single time that person returned to me and sat there. And I made sure to see them, hear them, value them, and build that rapport. Your hygienist is so valuable for you in that way. They can do that when dentists don't have much time to do that anymore, right? So listening to what they have to say and taking that, man, that is so much more valuable than paying a consulting company. That's so much more valuable than reading a blog.
Mm-hmm.
Those people are showing up for you.
Mm-hmm.
Find out why and show them that you value that, or what's not working for them,
Yeah.
I should say as well.
Wonderful recommendation, and really do appreciate your time and all that you've shared. I know you're passionate about this. Your passion comes through. I'm excited for you and what you're building, and I'm excited for everybody who has been watching us. And I'm imagining that there are a sizable number of people who say this was good. I would like to know more. So you mentioned about collaborating or being able to help people. What's the best way for people to reach you?
Well, I'm on LinkedIn. You can find me under Amber Correra. I have an Instagram page called the Hygiene Suite. And so just reach out. I love people who are passionate about oral health care and dentistry and the profession that we give our time to every day.
That's great. Well, I expect we will be continuing this conversation. I appreciate you, and thanks for being with us today.
Thank you so much. I appreciate it.
Yeah. So for everybody listening, watching us, this is Dr. Matthew Norton, and I have been with Amber Correra. This is the Truth Behind Dentistry podcast. Look forward to seeing you next time. Thank you.
Thank you.